All right. Today, I would really like to talk about how we can address the chronic disease burden and specifically diabetes mellitus type 2 utilizing artificial intelligence. And as Jesse earlier introduced me, I'm Sandeep Reddy. I'm the founder and chairman of Medi-AI. But before I get to the slides proper, I would like to pay my respects to the traditional custodians of the lands upon whom we gather and pay my respects to the elders past and present. The outline for today's presentation is, firstly, I will talk about the level of burden chronic diseases imposes on healthcare services and how digital health and specifically artificial intelligence can be a solution. And then we will hone into diabetes, which again, as a chronic disease, imposes huge burden on health services and on the population in general. And then I will introduce our product, which we are launching very shortly. And we'll talk about how the product can address some of the issues diabetes places on patients, but also how it can reduce the burden of diabetes and chronic conditions in Australia and elsewhere. Now, a quick run through chronic disease burden. We all know chronic conditions is any medical condition that lasts longer than 3 months or longer, and includes a range of complex, long-lasting health conditions ranging from diabetes, hypertension, high cholesterol, and including mental health conditions. But now, when you look at the burden that chronic conditions impose on health services, in fact, when you look at the statistics, it's huge. World Health Organization states that major chronic diseases account for almost 60% of mortality and 43% of the global burden of disease. That is a staggering figure there. And then when you look at the spend, healthcare spend, about 75% of the healthcare spend is on chronic conditions. So you can start to fathom that this is really a huge burden and there don't seem to be any solutions coming in through. However, with the emergence of various health technologies, it seems it's a right time for us to explore these technologies to address this huge chronic disease burden. For example, we know that huge amount of health data is being collected through several sources, whether it's through wearable devices, smartphones, and electronic health records. Now we have various technologies that can gather the data, but also garner intelligent insights to help improve health outcomes. Now, within that range of healthcare technologies, artificial intelligence, specifically machine learning, has the ability to analyze that huge amount of data, be able to recognize patterns within the data, and be able to derive interesting and important insights to help with the clinical treatment and management. You may ask, why machine learning? Because the way the computational architecture of many machine learning models, including deep learning models, is that it can analyze complex and hierarchical and hybrid kind of data better than any other technology or even statistical methods. Now, if you look at the chronic conditions and look at artificial intelligence, of all the chronic conditions, the disease that can benefit most from the application of artificial intelligence is diabetes. Now, we all have heard of diabetes, but did you know that there are 3 types of diabetes? And if you take into consideration the name itself, there's another type of diabetes, but we'll not go there. But mainly we are talking about 3 types of diabetes, type 1 and type 2 and gestational diabetes. But for the purpose of today, I would like to focus on diabetes type 2, which is really because of insulin resistance and because of the body's resistance to insulin. There is accumulation of sugar over a period of time, and that can lead to various complications, including acute complications like ketoacidosis, but long-term complications like nephropathy that affects the kidneys, retinopathy that affects the eyes, cardiovascular disease complications, but also diabetes foot and so forth. In fact, somebody quipped that diabetes can affect the whole of the body from the head to the foot, including head and the foot. So we can see that diabetes, as it progresses, presents a huge cost, both clinical costs and also other types of financial costs to the patient, but also to the health services. So the main treatment principles for type 2 diabetes is, first, you start off by recommending lifestyle improvements. It could be improving your physical activity, but also improving your nutrition so that you adopt good nutrition. But also later on into the progression of the disease, you introduce medication that can enable insulin absorption and secretion. Now, similar to chronic conditions, diabetes can also be a huge burden. We already seen that there is both acute complications and long-term complications. By that itself, we can infer that there's going to be costs on healthcare services. But then when we look at the figures itself, it's staggering. Again, in 2015, the global cost of diabetes was estimated to be 1.31 trillion US dollars. That's a huge amount there. And by 2030, it's projected that the prevalence of diabetics adults will increase by 69% in developing countries and by 20% in developed countries. Again, these figures kind of like give you that estimation of how diabetes can be a burden on in any part of the world. Now, just like with the previous discussion, we can again utilize data coming in through wearable devices and through other sources to able to garner and get intelligent insights, and then be able to provide targeted interventions and also help with the long-term management of the condition. Now, if you look at the research in terms of use of artificial intelligence in diabetes, it's exponentially increasing each year as more and more applications are coming in through and being tested and validated. So there is ample amount of evidence as to what applications work in terms of diabetes type 2, but generally in diabetes. So really there is a lot of information out there from that we can borrow in terms of utilizing artificial intelligence to address diabetes. Now, if you look at the range of artificial intelligence applications that are targeted to address diabetes, both type 1 and type 2, we have applications that can help with blood glucose prediction and control. We also have applications that can detect hypoglycemic and hyperglycemic events, which both can be quite dangerous and risky for patients. But we also have machine learning applications that can help with insulin bolus calculations. Further to that, we also have clinical decision support systems that can predict the risk of various patients either having diabetic complications, and if they don't have diabetes yet, the risk of them developing diabetes. But really today, I would like to focus on one aspect, that is how artificial intelligence can be used to help with diabetes lifestyle management. So if we look at various chronic conditions, not just diabetes, there is usually some risk factors that are occurring in the background, which lead predispose somebody to develop various chronic conditions, including diabetes. And these risk conditions include sedentary lifestyle, stress, lack of follow-up visits, non-adherence to medication. And this kind of risk factors are not just unique to diabetes, they can also be risk factors for other cardiovascular conditions and chronic conditions too. Now, what research has shown that is, with these risk factors in the past, really clinicians and other care providers were very in a difficult predicament in terms of being able to address how they can modify the behavior of patients and the general population such that they can adopt healthy lifestyle. It was really, really hard. But recently, research has shown in the past many years that a particular model really, really helps in behavioral modification in this kind of cohort. And that particular model is called as a virtual health coach model. And this virtual health coach model is really utilizing a combination of change and cognitive based therapy models, psychology models, And basically what it does, it monitors the physical activity and the nutrition intake of that particular patient who is involved in that particular program, and issues timely reminders and in a personalized way. In that way, it acts like a coach. Imagine a sports coach training an athlete. Here you have a health coach training a person to adopt healthy lifestyles. And this has shown to be very efficacious through various studies. So what our company has always been interested in utilizing evidence-based approaches in whatever projects that we are involved with. And similarly, with the software that we have introduced to help diabetic patients, we have borrowed these evidence-based principles and validated studies to develop a software called Helia, which helps with the management of diabetes utilizing that virtual health coach model. And here you can see a high-level conceptual architecture of how this particular diabetic model works. Basically, it's a model, it's an application that you can download on your phone for patients, and the patients can use it to monitor their blood sugar levels, their physical activity levels, their dietary intake, and in the future, blood pressure levels. But something that's very, very unique to this application is the utilization of cutting edge technology like natural language processing and computer vision and other artificial intelligence methods like machine learning and analytics to analyze that data that is coming in through and provide real-time insights, not just to the patients, but also to the health service provider. Now, I would like to take your permission to actually provide you a demonstration. It's a video. It's a video which showcases the various features of the application. As it is a bit lengthy, I will be providing some commentary at important points. So as you can see, there is a whole lot of features. And in fact, that's just a couple of features that you're seeing in the demo. And there's more in the application itself. Because of the interest of time, I won't go in detail with all the features, but I just wanted to highlight a couple of key features here. One is the level of personalization this particular app provides. And this is so important when you look at research. The reason why patients do not follow the advice of medical doctors or care providers, or just generally is because they don't see the value of those particular recommendations, but also ongoing, there isn't really that support they require. Once you leave the general practice premises or you leave the hospital and you go back to your home, you don't have that level of oversight that care providers can provide. And this is where we step in. We try to fill in that gap where we provide this intelligent health coaching, but also provide a level of personalization that the patient can relate to, including setting goals and then being able to track that goals to their particular objectives in real time. As the demo indicated, we just don't provide access to the patients itself. In fact, we provide real-time access to the care providers so that they can track what is going on with their patients and, if necessary, be able to intervene in time. And obviously, this happens because of based on the permission of the patient. But once the patient provides the permission, the care provider can real-time track what's going on with their patient. So in that way, continuous care is enabled. Now, as I mentioned earlier, there are so many features that we are introducing. In fact, we can claim to be the most comprehensive diabetic app in the whole of the world that provides this level of features, and but also integrates with the care providers. Now, in addition to what you're seeing, you already may have been impressed by the number of features. We also have a patent here in Australia, basically validating and providing the credibility towards that particular application that we introduce. The other unique aspects to this particular application is it's been developed by doctors, including people like myself, but we also involve other general practitioners and endocrinologists in developing the app. So you can be confident that it's been developed by credible people, but it's also been backed by research, evidence-based research in incorporating virtual health coaching models that has been validated in various studies. We also utilize artificial intelligence techniques like computer vision, natural language processing, machine learning, and analytics. I already mentioned that we are patented, but we are also have a independent university validating the efficacy of those apps and identifying how they can help with improvement in patient outcomes. So you can see that we have undertaken a comprehensive process to provide you that app. And we are in the process of imminently launching this application here in Australia and in New Zealand. But we also have plans to expand that particular application to other chronic conditions, including mental health. The reason is because the underlying behavioral modification that can happen through this application can also benefit other chronic conditions. But we also want to make sure that this particular application is customized to those health conditions. So it may be in the next or a couple of months later. We also want to personalize the app further to what we already done. So that's also in the plan. In summary, to close off the presentation, chronic conditions presents a huge burden on health services and patients alike, and health technology can play a huge role in addressing these issues, whether it's chronic conditions like diabetes, but also in other conditions in health technology. Specifically, artificial intelligence can play a role in diabetes lifestyle management. Within this context, we have introduced this particular application called Helia, which can benefit both diabetic patients and their care providers in better managing diabetes. With that, I end my presentation and very happy to take any questions that may arise.